Hi, my name is Jessica Bettendorf, and I am doing my program evaluation on ADHD Child and Family Services. So the organization's target population is children and adolescents with ADHD, along with the parents of the children and adolescents. The youngest the organization treats is ages 3. However, Laura, the founder and clinical director that I spoke with, she reported that they typically work with children ages 6, 7, and 8, and they actually don't really feel comfortable giving an ADHD diagnosis until a child is around 8. Um, so Laura specializes in working with children younger than 12. And she does have other therapists who work with adolescents. So, how does this organization or program meet the needs of the target population? Well, Laura developed a unique approach to treating children and adolescents with ADHD by involving the parents. Um, she she found that in typical like talk therapy, the child or adolescent is maybe given some skills, talking about their feelings, and then they go home. And nothing really, they don't really see much change. So she found that by incorporating the parents into therapy, there was change was a lot more effective. She said that typically after between like 12 and 14 sessions, they'll see significant changes and they'll actually like graduate the child. Um, let's see what else. Uh, so the therapy also involves teaching the parents skills on like how best to support their child. So they kind of the child and the parents work together outside of the home to use the skills that they're learning in therapy, like time management, organizational skills, learning patience, waiting your turn, things that children and adolescents with ADHD struggle with. So how has the program or organization grown since it began? So it started out with just Laura. She was working in community mental health at that time. And where she was working, she noticed that the children with ADHD were being treated in the same way that children with trauma were being treated. And she was like, yeah, it's effective for treating trauma, but it's not really addressing the ADHD. So she saw a big need for that. So in 2018, she started her organization. Um, let's see. Sorry, I'm just looking. All right, so since then, she hired more therapists, and she started incorporating other types of therapy into treatment, like music therapy, art therapy, group therapy. She said that she was really trying to make like therapy fun, um, to help get these kids with ADHD engaged because kids with ADHD struggle with lack of focus. They get bored easily, distracted easily. So by making it fun, they're more willing to engage, and she saw more success that way. Let's see. She also increased psychoeducation for parents, like teaching them about ADHD. She also found kind of interesting. A lot of the times, the parents also presented with ADHD. So she said, as an added bonus, when treating the families, the parents would also get some benefit as well. She's also currently working with a psychiatrist to do some prescribing. So I did ask her, like, what are her thoughts on medication? And she said, they're great if the goal is to help the child focus. So like neurochemical things. But if the parents are just looking for like a quick fix to like solve all their problems, medication is not going to be useful. It's helpful to use the medication in combination with the skills training and practicing outside of therapy. Let's see. So she's also one of the challenges of this organization is that there aren't enough therapists who specialize in just ADHD. She said a lot of times therapists don't want to be like pigeonholed into just ADHD. And they're currently turning away on average 80 clients a week because they simply do not have enough therapists to meet the demands. So there is a potential huge opportunity out there for therapists wanting to specialize in ADHD. All right. How are stakeholder voices incorporated into the organization? So Laura really tries to listen to the patients and meet the kids where they're at, which is how like the music therapy program got started and the art therapy. She's trying to focus on what's going to work best for these kids. Um, let's see. The current strengths of the program kind of already talked about that. It's a very unique approach to treating ADHD. She saw a need in the community and went out to fill that need. And it involves the whole family. So gets everyone working together. And the challenges talked about, not enough therapists. The way she's addressing these challenges is that she's actually started taking on student interns. Frankly, I wish I had known about that when I was looking for my internship site. But there is a huge opportunity out there. So those are all the questions. All in all, I was very impressed with Laura and ADHD Child and Family Services. It seems like a great way to treat ADHD. All right, well, thank you for watching. Have a good evening. Bye.